Not iPhone.
No.
Oh.
All right, here we go. Yes, we are live. Welcome everyone to Talk Tuesday. This is a first of its kind. We are Hartford Health Initiative. My name is Chanika Bailey Perrier, and I am here with Courtenay Jackson.
Yes.
Said it correctly. Yes, great. And so what Talk Tuesday is, really quickly, is just a way for us to connect with the community, connect with our community leaders, and talk about the resources and things that are happening here in the Hartford area. Our first guest today is going to talk about a project that has gone on since maybe the past 3 years.
Yeah, we're rolling into year 3, so 2
Okay.
years now.
Yep. So we're going to be talking a little bit about that, and we just want to connect with you all, have a conversation. If there are any questions, please post them in the comments below, and we will try to get to them as best as possible. All right. So, just really quickly, introduce yourself.
Okay, Courtenay Jackson. I'm the North Hartford Prime Zone Director at the City of Hartford, and also the city's liaison in the Sin Pipeline Project.
Awesome. And so, the second, what we want to get into is what are the main goals of the main focus of the Sin Pipeline? What is it?
So on paper, you'll see that it's about creating this coordinated pipeline of services. But what does that mean in real life? It's all about access. So we want to, if you think about it in this term, basically everyone in the North Hartford Promise Zone will, within walking distance, should have access to any program, service, or support or information that their kid or their family might need. So the Sin Pipeline is really focused on youth. It's a Department of Education grant, but the whole idea is that if we support all of the needs of the youth, that's their family, that's their household, we'll knock down the barrier so they can go to school and be their best selves. So you can't be your best self in school if you're worried about what you're gonna eat, or if your parents are stressed, or if something's going on with a sibling health issue, any of those things. So we're looking to create access to all of those programs and services. And what you don't know, you don't know. So if you don't know how to access information, if you don't know that there's actually a service available to you, sometimes it's even right across the street. You're not going to get your needs met. So the whole idea is let's create that access. And then on the flip side, when that's sort of the resident side, but behind the curtain, we looking at all of the service providers and saying, you know what, will you be willing to accept a hard referral? What would that look like? How do we bring you together with other organizations to leverage some of your existing money, service, resources, anything, so that we can connect and really help people out. And once we get someone sitting down and providing the service, we want to talk about all of the services. So, a person doesn't have to walk through 6 doors to get, 6 different types of services. You can walk in 1 door.
Right, and they are there to service you from beginning to end. So I think a key term that I saw in like paperwork or postings is like cradle to career. That is what you that is the coin phrase. So from baby to adulthood, that is how we want to access we want individuals to be able to access.
Exactly.
Got it.
When you go into that doctor's appointment, and there's a conversation around, the health of the baby that's in your stomach, let's start talking about what's going to happen in school. Let's start talking about chronic absenteeism. Before your kid is even there, you have the information to know, if I get my kid in school a certain amount of times, they're more likely to succeed.
Yes.
But once we have people, let's get them all the information and stay attached to them.
Got it. Awesome. So really quickly, we talked about the goals and the focus. How will the goals and the outcome of this initiative improve the quality of life for individuals or residents of Hartford?
Definitely. Again, bringing back that word access to program services. Again, the idea is that a lot of times youth, families, they're struggling with something, whether it's basic needs, whether it's, like I said, mental health. If we can help move the needle in those areas, again, maybe your kid comes to school a little bit more. Maybe they're not getting into that argument with that teacher. And then when there's other resources needed for your kid, you know, one thing about the North Hartford Promise Zone, we're a young neighborhood, the youngest in the city, so you don't know what you don't know. And even when I think back in the days when I lived over here in Stowe Village, like there was an older woman there that my mom would go to have a conversation and say, what should I do? And she would know how to navigate different things and where to go. Now, the way our city is set up, you could live on the same street as somebody and never have a conversation with them. That's true. That access to information is harder now. We're more connected and less connected than ever in a lot of ways.
Got it.
So it's all about, you know, getting people that information so we can, again, let's deal with that stuff. Especially if there's resources for people, let's get it to them. And a lot of times what I see is the people with the most need are usually a day late in getting that access.
Or you hear that key phrase, I didn't hear about this, or I didn't know.
Exactly. But one thing again about the SIM pipeline, it's all of us. So that means we all have a responsibility. And that means if I'm a resident, if I hear about something, it's my job to share it. If I'm a service provider, it's my job to give the best services humanly possible. So you know, it's really us coming together as a community and accepting as a community is our responsibility to look out for each other, because nobody does it on their own, no matter what they say.
Right. That is very true. And just sharing a little bit of feedback that we received when we were doing our focus groups as an organization, a lot of the people never heard of this Pipeline project. So, you know, our Siobhan, our executive director, you know, gave this, or whoever was leading the focus group will just give a small little spiel of it, but it's just like, wow, okay, we didn't know that exists. We didn't even know that this thing was a idea or a project happening. So, yeah, and I think the feedback that we did get the most of from those focus groups was that we need more things like this.
100%.
So,
and I think really, you know, to not look at it as a program, but more like a system. So we need everyone to utilize the system. So if you need to communicate with the community, go through the community conversation. If you need to communicate with service providers, go through the meeting that we have already with the service providers. A lot of times, again, we're small in Hartford, and the idea is also that when we get this thing right, we bring it, you know, through the whole city, but it's, you know, in a smaller area so we can fail forward, we can learn, we can get the input from the community and then build a system that's sustainable that we can work with for, you know, the foreseeable future.
Yep, that is true. So as we're talking about getting everybody involved, that leads us into our next question of how does the community get involved? So not just service providers, not just the local organizations. How does a resident, well,
I get it.
I was a former resident.
We still claim,
but I'm still here, Hartford to my heart.
Yes.
However, how does a Hartford resident get involved in this system or this pipeline?
So I think the very first and easiest way to get attached is going through the community conversations, a monthly meeting. You can go there and get access. And then there's several other things. So there's an advisory group, and none of this stuff is like prescriptive. We don't say we want you to be an advisory group. The community makes the selection. Through the NRZs, through the parent teacher associations, all of those things. They sort of make the recommendation, and that's how we land on those advisory groups. Also, we have a governance structure, or we have these working groups that's behind the scenes trying to work things out for the SIM pipeline. So how are we going to connect with providers? How are we going to connect with community, data, you know, this whole system? There's work groups behind them, but one thing that we always make sure is that there's a resident at least on all of those tables. And they're paid. So I think back to one of my first meetings when I came into the role in the North Hartford Promise Zone, and Miss Helen Nixon and a couple of others were there. Yes, there was nothing moved without Miss Nixon. But she was there, and the meeting was at City Hall, and she was paying for parking, and she was the only one that wasn't at work. So she took time out of her day to come. Right. And she's the person we want to listen to, that we want to talk to. And it's like, wait a minute, that's not, we're not doing this right. If we really trying to hear from the community, we got to set a table in a space where it's more comfortable for them. And if their voice is the strongest and the loudest that we need to hear, that don't mean I look around the room, everyone's getting paid, they're not getting paid. Everyone's in the middle of their work day. You had to take off work. So looking for different ways to connect with that. But again, it's the advisory group. You can get on several working groups. And then also come to the community conversation. But I think one of the most important things is you have to share the information. You have to be a champion for the work. So if you go and you receive a service, you have to go back and say, I received the service. And if it was a raggedy service, you need to come back and tell us so we can address it and try and get things.
So that constant communication.
Yes.
And these community conversations, where are they held? How often are they held?
So they happen on a monthly basis.
Okay.
I think right now, while the weather's bad, it's a Zoom meeting. But when things start to, warm up a little bit, they'll be in person. But the idea is there when we have conversation, and if there's an issue that rises to the top, our plan is to, hear that, then bring it back to the service providers and ask them, one, if you say, this, and I'm going to make this up, if you say we need more fencing, we need to teach fencing in our neighborhoods. Got it. We would go back to the service provider and say, number one, who's already doing this training? Number two, who's willing to do this training, and what's the barriers toward building this out so everybody can receive fencing training? And then bring it back to the community conversation and say, look, you were heard, and here's our response to it. So
providing an actual solution
exactly.
Versus it falling on deaf ears.
Exactly. And I think part of the community conversation, we have to have pointed conversation, because we could talk about the problems all day. Yeah. We need to hear from people around, what do you need to see that will help you get past whatever barrier? And then we're going to go out and figure it out. And if there's no one doing the work, then we have to find somebody that's willing to do it and train them and put them in a position. So that's really ascendant action. It's all of us working together to get to real answers to help people.
Yes. Yeah. And so we talked about like the different avenues in the way that you can get involved, and how there are certain stages or areas that you have to kind of go through. The last question is really honestly geared towards healthcare, is asking as often as we see healthcare as complex, like, there are so many barriers where healthcare should just be a service or a thing that everybody has. How do you ensure easy access to being a part of the pipeline?
Yeah, well, I think a big piece of that is, one, asking people where and how they want to be serviced. So I can think I'm doing something that's more convenient, but it may not be convenient for you. So I have to ask you, if we put a resource navigator at Parker Memorial, would you go there and use that service that will, connect you to additional services? Some people might say no, some people might say yes. Right. We also know our city, and there's certain people that's not going to certain parts of the town. Yeah. So with that in mind, we have to ask the question of, where would it be? Are you willing to do, make connections via Zoom? These are all real questions, and we also have to get past, the group of people who come to all of the meetings. We also need to get deeper into our community, to the folks who aren't showing up. So that's part of the work, and part of the work where as a resident, you have to help, like, go and get that information, bring it back. Go and get those people and connect them back to these conversations, because again, that's the only way we get to the real answers, just asking the people. And I think, again, creating access is everything. So whatever that looks like for you as an individual, that's what we need to develop, or continue to develop.
Okay. Yeah. All right. So I was telling you earlier that I am a stickler for time, and I don't want to keep our good people or followers too long. I'm just going to check to see if we do have anybody tap in here, or if we have any questions. And we don't.
Excellent. Okay.
So
we're always available.
Exactly.
Questions.
Exactly. And so just really quickly, before we sign out, again, The idea behind these Talk Tuesdays is that, we'll be here every Tuesday or every other Tuesday. However frequently we're going to come on here, just when we put live, tap in, and put your questions in the comment boxes because we want to connect with you. How, again, can we contact you? If you can just share with us your information again, and we're gonna, end it.
Yeah. And make sure y'all log in every Tuesday and have this conversation and tell a friend to join in. You can always contact me. It's Courtenay.Jackson@hartford.gov, and Courtenay is Tenay, not Courtenay. It's French. Ask Nina about that, right? but this is a part of what's needed. This is the access to information. This is the access to people. So share, like, do everything you have to do to get this. Tell a friend to tell a friend.
Yes, awesome. Thank you so much for joining us today, and we will see y'all next Tuesday. All right.
Take care.
Come now. Why are we not? Okay. This is our first.